Cases of COVID-19 go completely exponential in South Korea. Iran is struggling with a complete epidemic outbreak. Hello everyone, this is Chris Martinson with your COVID-19 coronavirus update for February 22nd, 2020. I'm titling this one, It's Exponential, and I'm recording this at about 7:30 in the morning on Saturday the 22nd because I have to tend to other things today. So some of this data may be a little bit old by the time you watch it this evening. Things are moving that quickly right now. So let's go right to the numbers. First, what can I tell you? We're seeing a big outbreak of cases down here in Italy, and this is a pretty dangerous thing that's happening there as well as in Iran. I've got to tell you, we're going to talk about these cases in the United States, something very puzzling and very much not right with these numbers, and I don't know what to tell you about that. Same thing with Thailand. This just doesn't make sense that it's stuck at this number. This doesn't make sense. Places that are testing aggressively, South Korea is probably testing the most aggressively. Of course, they're finding massive outbreaks there. So let's take a look at this really quickly. Very important clues are coming out of the Italian data right now. And I don't trust the data that we've got out of China. Some is okay, but a lot of it really isn't. So I think Italy is going to show us some things here that we need to know. So will South Korea in this case. 5 new cases in Italy. There are now a total of 28 cases, mostly in this one region right here. 1 death, 1 critical, at least 14 serious cases. 14 out of 28. That's a 50% serious ratio here. I don't know why it's presenting as so much more serious here than in other places, but that's a very troubling statistic right there with a 50% serious rate. We were expecting maybe 20, 25%, something like that. 1 new death in Italy, 75-year-old woman, hospitalized a few days ago for pneumonia. So that progressed very, very rapidly. Italy now has the highest number of cases and deaths in Europe. So that's doubling the number of Germany, now in second place. And this 38-year-old man near Lodi is in critical condition, mechanically ventilated in intensive care, according to the parents. 38 years old, critical condition. Okay, so something feels different about this situation here right now. I don't understand why this is the case. Perhaps the Italian medical system has a different standard for what they consider to be serious. I hope that's the case, and it's not that this virus has somehow become a little bit more deadly somewhere along the way. And 12 new cases in Italy was this update down here. And schools in 10 towns will stay closed for 2 weeks. People must be distantiated. I don't know that word. Distantiated. I like it, though. Has a good ring. Because this is a virus that is transmitted very effectively at close range, says their infectious disease expert. So the Italian data says it spreads easily, and it's a very serious illness. South Korea, though, these numbers are absolutely blowing my mind. The doubling time, February 18th, 31, February 19th, almost a complete doubling. February 20th, a complete doubling. February 21, a complete doubling. February 22nd, and this day is still young, a complete doubling. So the doubling time in South Korea now is just 1 day. And maybe this is because they're doing more aggressive testing, and they've certainly have done thousands more tests than have been conducted in the United States and other countries. So maybe they're just detecting it faster. Maybe it's been there for a while growing, but this is representing how much better they're getting at detecting this. We don't know. But even with an R0 of 6.7, which was the DARPA study that came out, that was out of Los Alamos, that we looked at a while back, said that the doubling time would be 2.4 days. I don't have any good explanation for a 1-day doubling time except for better detection. Iran, 13 more coronavirus cases. They're confirming there 2 new deaths. I got to tell you, though, they've got way more than the number of cases that they've detected so far. Because let's look back at Iran, 28 cases. Here's those 10 new ones. Here's that 1 death. They're not reporting anything about recovered versus critical, all of that. But when we look at the Iranian data, here's our clues. We found that in British Columbia last night, reported an infection in a traveler returning from Iran, and Lebanon reported an illness linked to an Iranian traveler. So what are the odds that 2 people traveling to both Lebanon and to British Columbia managed to run into one of those 28 infected people in Iran. Probability is 0 or very close to it. So based on this, we're going to have to say that Iran is a hotspot right now and really has a lot of cases that are raging. So that's something else to keep an eye on here. Again, this is a very, very serious illness, and we need to keep our eyes on it. How serious is it? Well, not that serious. These are, somebody took a picture of the front pages of today's newspapers. As virus spreads in Italy, Iran, and South Korea, coronavirus pandemic totally absent from the front page of Washington Post, New York Times, and USA Today. There's just nothing on there. Something about Roger Stone being sentenced. There's another thing about Roger Stone being sentenced. Something about politics, more politics, more politics. So apparently politics is the most important thing that you should be paying attention to right now, according to U.S. newspapers. Instead, we might notice that we now have confirmed asymptomatic shedding, which would be a critical component of asymptomatic transfer. Nice study here done in the New England Journal of Medicine. Came out 3 days ago. And this was pretty interesting. A couple things we want to raise about this. Their analysis suggests that the viral nucleic acid shedding pattern of patients infected with SARS-CoV-2, that's the other name for COVID-19 or this coronavirus, to differentiate it from SARS-CoV. This is number 2. SARS-CoV-2 resembles that of patients with influenza and appears different from that seen in patients infected with SARS itself. The viral load was detected in the asymptomatic patient, and so that's singular, but they did detect a viral load in an asymptomatic patient and was similar to that in the symptomatic patient. So asymptomatic patient had a similar viral load, which suggests the transmission potential of asymptomatic or minimally symptomatic patients. That's a reality. So these findings, they say, are in concordance with reports that transmission may occur early in the course of the infection, which I think is now confirmed. This is some data to back that up, and suggests that case detection and isolation may require strategies different from those required for the control of SARS. Now, SARS pretty much only transmitted once somebody was symptomatic. That's a really easy situation to contain, relative. Still hard, but much easier relative to a situation where you're trying to contain people who might be asymptomatic, and you don't know who's asymptomatic. So imagine that taxi driver in Japan or somebody's on an airplane. Do you quarantine everybody on the airplane or every taxi ride that went along with that driver? That's the difference here, and that's why this is so difficult to contain at this point in time. And to decode this a little bit and suggest this line here, suggests that case detection isolation may require strategies different from those required for SARS. The decoding of that says that if or when authorities decide it's time to get serious and to really block the transmission of this, all you can really do is put a big quarantine around an entire area you think is infected or infectious, and not let people come or go, which is exactly what we're seeing in China, who I think is doing everything they possibly can to contain that. And as we've seen, that required shutting down effectively 90% of their economy. I think everybody needs to be ready for that. So let's contrast this now with the most recent CDC briefing. This just came out yesterday here. And so I'm just pulling this here from the CDC website. Here is the URL for that. Going down into that briefing, we're looking here now. This is Nancy Messonnier, who I think has just been doing not a great job in this role, being very, very cagey with things. So she starts by saying that they're changing how they're reporting, or just putting some more fine-tuning around the reporting. They're now making their case counts in 2 tables. One only tracks people who were repatriated by the State Department. So that explains who overrode the CDC health officials who didn't want to put the 14 infected U.S. patients from the disaster Princess cruise ship, as I'm now calling it. Somebody overrode the CDC health officials, put those 14 infected people on a plane of putatively potentially uninfected people and rode them home. I think that's the State Department was involved in that, if I read this sentence correctly. And the second table tracks all other cases picked up in the U.S., picked up through the U.S. Public Health Network, which, again, is not testing for anybody who hasn't either been in China or been in close contact with somebody already known to have COVID-19. All right. The CDC will continue to update these numbers Monday, Wednesday, Friday, keeping track of cases resulting from repatriation efforts separately, because we don't believe those numbers accurately represent the picture of what's happening in the community of the United States at this time. Well, you know what would represent something more accurately about what's happening in the community is if you were doing community-level testing, kind of like South Korea is. They've run thousands and thousands of tests now, and they're even testing people who are asymptomatic, which is, of course, important because that's what the data would tell you to do. So as of this morning, Friday morning, when you break things up this way, we have 13 U.S. cases versus 21 cases among people who are repatriated. 13 plus 21, carry the 1, add some things up, 34. So they're only reporting 34 here, which is odd because there's 35 showing up in every other table. But that's it. That's the total amount that's being noted here in by the CDC is 34 right now. The repatriated cases include 18 passengers from the Disaster Princess, 3 from the Wuhan repatriation flights. Okay, this is where I want to focus in, because here's where it gets critical. I want to update you on the status of the repatriation efforts. Yesterday, nearly all of the remaining people who returned from Wuhan, China via State Department chartered flights, who have been quarantined at 4 Department of Defense installations across the U.S., have completed their 14-day quarantine. We're truly thankful, blah, 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 some PR speak there. I want to be clear that someone who has been released from quarantine is not at risk for spreading the virus to others. Specifically, they are not infected. That's really strong statements. I would think that there's room here to say is at low risk or extremely low risk, but to say not at risk is a very declarative statement, and to say specifically they are not infected is a very declarative statement. Why? I don't know, because we get data like this coming out all the time. This is from February 22nd. Oh, we've had data like this for a while. Coronavirus incubation could be as long as 27 days, Chinese provincial government says. This is out of Reuters. In Shanghai, a 70-year-old man in China's Hubei province was infected with coronavirus but did not show symptoms until 27 days later, meaning the virus's incubation period could be much longer than presumed 14 days. Let me check. 27 is longer than 14. Yep, that could be true. All right. A longer incubation period could complicate efforts to contain spread of the epidemic. Yes, that's absolutely true. And so they talk about this. He on January 24th drove his car up to somewhere where he had close contact with his sister who had been infected. And then he had a fever on February 20th. Check out that time frame right there, right? And tested positive for coronavirus a day later. All right, we don't know when he would have tested positive coronavirus if they had been testing him earlier, because, of course, he might have tested positive during an asymptomatic stage. But he was apparently asymptomatic for that 27-day incubation period. All right, in the U.S., the numbers just don't add up at all. This is what I posted last night. Costa Mesa seeks to block transfer of up to 70 coronavirus patients. That's how the article read, up to 70. Well, I said that's weird because the U.S. has only admitted to 35 total, 34 if you count the CDC from yesterday, 35 total infected with coronavirus with 6 recovered. That leaves 29. How can up to 70 be confirmed, be shipped to one place? Must be a typo or misunderstanding. And as well, yesterday I talked about potentially, tens of thousands of Chinese students returning to the United States from areas where coronavirus was known to have been in an outbreak when those students would have been getting on planes. Newsvoyer helped me out yesterday via Twitter saying, great vid today, thanks. Actually, in the 2017 to 18 academic year, there were 360,000 Chinese students enrolled in the U.S. So, maybe hundreds of thousands potentially coming back from infected areas. So let's go to this Costa Mesa situation, because by seeking to block, what's actually happening here is that Costa Mesa has filed a federal suit. Thank you, Kristen, here for supplying this, which is the actual court document. Let's look at this very quickly. Costa Mesa files this suit, files it in the Central District of California. It's a U.S. district court. It's a federal court. These are the plaintiffs versus the defendants here, which includes the United States of America. That's pretty broad. The Department of Health and Human Services, the United States Department of Defense, great, the United States Air Force specifically, Centers for Disease Control, CDC, the state of California, Fairview Developmental Center, this is the place they want to put these people, the California Governor's Office of Emergency Services, and the California Department of General Services. Wow, they just sort of threw it out there, and they're seeking a temporary restraining order to block this thing from happening. Let's go into the suit because there's some really interesting data that shows up in here. The plaintiffs, which includes the city, are seeking this temporary restraining order, this TRO, and order to show cause, and OSC, to temporarily restrain defendants and their agents, servants, employees, attorneys, and all those in active concert or participation with defendant from transporting persons infected with or exposed to the coronavirus to any place within Costa Mesa, California, until an adequate site survey has been conducted. The designated site has been determined suitable for this purpose. All necessary safeguards and precautions have been put in place, and the public and local government have been informed of all efforts to mitigate risk of transmission of the disease. Well, that seems reasonable. You'd want to make sure the facility is good. It's not like you'd want to just chuck 14 people into the back of a plane who've got this disease. It's what we're seeing here is that the local authorities have looked at what the feds have been up to and said, we find these wanting, and we don't have faith that you're going to do this right. In fact, they had such low faith and they felt so blocked out of the process that they felt they had to file a suit, and they did so. Really, really quickly, getting this out here on the 21st, yesterday. So, and apparently they had just found out about these efforts sort of through the grapevine and quick ran to court and said, no, not so fast. Carrying on, this is from their introduction. I found all of this really just well communicated and very logical and ordinary and reasonable. It reads, this highly communicable and deadly disease has no known vaccination or cure and has killed thousands. Its scope appears to be growing worldwide at an alarming rate. Absolutely true. U.S. public health officials have sounded the alarm over a potential global pandemic. It's true. The plaintiffs now seek to prevent Costa Mesa from becoming ground zero to a state and potentially nationwide public health crisis caused because the state and federal governments have not sought to include local officials and emergency personnel in the planning and execution of their efforts. I like how that's worded. It says, we don't want to become ground zero because you didn't include us because we don't trust how you're going to conduct this thing, right? The relief sought by the plaintiffs is modest. It seeks only to ensure that all necessary steps are taken to protect public safety, that first responders and health professionals receive the training they need to protect themselves and their community. And that, this is critical here, the state and federal governments stop acting under cover of darkness, which would create greater panic and confusion among the population. Bravo. Golf claps here. That's exactly right. And that's exactly what needs to happen here is that we need that public transparency, just like what I think you're seeing in Taiwan doing a great job, Singapore doing a great job of the exact opposite of operating under the cover of darkness. People need to know, need to be informed, need to understand what the risks are, need to understand that this thing is asymptomatically spread, that it's spread through aerosols, that it's not just droplets, that it's highly virulent, that it's a very serious disease that is not like the flu. Look at Italy with its 50% case serious rate going on right now. So it's obviously something that has to be taken very seriously and not in the cover of darkness. We're all in this together. Let's all be informed and let's all figure out what we need to do about it. Great. So check this out, though. Under the statement of facts in the suit, I thought this was really just incredibly revealing. Defendants intend to relocate from 35 to 50 patients already diagnosed with the coronavirus from a secure location on Travis Air Force Base, where they are isolated from population centers to Costa Mesa, a densely populated city within a county of over 3 million. Well, they got a point there. But what is this 35 to 50 patients already diagnosed? This has already been telegraphed to them. There are only 35 admitted. Where are these other 15? The numbers are just not adding up here, even slightly. And the defendants plan to do so without first determining the suitability of the facility where these individuals will be housed. Well, wait a minute. Wouldn't they be moving them to a super awesome facility? The defendant's plan was announced at the 11th hour with no efforts to include local leaders, blah, blah. Fairview is the facility where they're planning to bring these people in. Fairview was previously used as a residential facility for individuals with disabilities that prevented them from living independently. So this is not a full-blown isolation and containment facility. It sounds like a place. It's a residential facility. It's a halfway house. It's a place where people who need support living would go. You know what those facilities look like. They may have locking doors, but I'm not sure what else they've got. Fairview is a dilapidated complex surrounded by residential neighborhoods, busy thoroughfares, and popular recreation facilities. It was not intended to house individuals infected with a highly contagious and deadly disease. Oh my goodness, okay, I'm out of words. I don't know what else to tell you about this particular situation. They, of course, Costa Mesa felt they had to file a suit because some bureaucrats came up with this brilliant idea to take the coronavirus patients that are housed in an isolated, secure facility and move them into a residential facility. What's going on here? There's something happening here that this doesn't fit with the idea that we only have 35 patients, that we don't have any others. Thank you, Nancy Messonnier of the CDC. Oh, yeah, it's contained. We don't have any community-level transmission, but we need to clear out. We need to clear out Travis Air Force Base because we just need these people out of there, and we have to ask why that would be. Remember, I talked about the fourth turning. The fourth turning is crisis, and it's marked by a profound loss of faith and trust in institutions. And I think when your local government feels necessary to file a federal suit against both state and federal actors in order to protect its own population, you're pretty far down this particular path. All right, moving on. There's already critical shortages showing up. Mask shortages, of course, just one of the many things. There was repeated warnings in the past that American hospitals are overly dependent on Chinese-made medical supplies. Masks is just one of those. So now hospitals in the U.S. are already having to ration their inventory amid one of the worst flu seasons in decades. So that's just sort of salt in the wound, as this is also a bad flu season. And there are a lot of reports showing up like here. The staff at Mount Sinai Health Systems received an email informing them that, among other measures, surgical masks will only be available in departments such as intensive care units, divisions involved with infection prevention, and emergency departments. And 2 states away, a pediatric doctor practicing in Maryland said the hospital is unable to receive more shipments of masks. This is true all over the place. I had another great article I wanted to show you from Forbes, but Forbes wanted me to sign in, and they wanted access to my Twitter account. And this just offends me. This is way off topic, but in order to gain access to read an article on Forbes, Forbes was asking to be able to see all my tweets, see my Twitter profile information and my account settings. That's a little invasive. See all the accounts I follow, mute and block. Be able to follow and unfollow accounts for me. So that's what? Get your hands deep in my pocket. Starting to get uncomfortable here. Update my profile and account settings. Get out of here. Post and delete tweets for me. Engage with tweets posted by others like or unlike or what. Create, manage, and delete lists and collections for you. What the? No. In a word, no. So that's my own personal fourth turning moment. I have a profound loss of faith in institutions. That includes no, Forbes, you can't do these things to my Twitter account for me. All right, just as a reminder, this is not the flu. It's just not SARS. We've got all these things now that are all but confirmed. I believe that this R naught is high as 6.7. This is what the Korean data is really supporting that 1 day doubling time is very, very concerning right now. We know about this asymptomatic spreading. Of course, we put that on here weeks ago. I'm convinced that there's just nothing that we can say except that it does spread by aerosol. So everything the CDC is saying that it's only by close contact, which is what's implied by the droplets here. It's more than that. And the healthcare workers that got infected and all of that suggest it's aerosol. 27 days now, I think instead of 24 days, we may have to bump that out a little bit. And I'm hearing lots and lots about vaccines. Of course, we discovered one in 3 hours, all these things. Many of them are, you just need to be aware, are very hungry small biotechs who love good PR. And some of it may be true. I don't know. But the vaccine development is going to take a long time because that prior work with SARS vaccines talking about that ADE pathway, it could be worse than nothing if it activates your immune system in a bad way. Still don't know about the whole smoking thing. I'm not really clear about that yet. And we're getting more and more information that men really are affected much more than women in this case. And of course, people who are older are much, much, much more at risk. In fact, people age of 1 or under seem to be practically immune from this thing, or it creates a very, very light disease. All right, that's all I have time for today, and we'll get you another one tomorrow. Peace, everybody. We'll see you next time.
Hi, folks. Adam Taggart here. Chris Martenson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.